Today we'll be discussing on food-dependent exercise-induced anaphylaxis. I like this interesting topic. That is why I'm taking this class. Plus, this is also there in IJPP. What is that? April June 2021 immunology. Okay, so could be a potential question. We have already discussed on anaphylaxis per se. So this was something different, little bit new. So we will just talk about it in the next, say, 5 to 10 minutes. That's all. It's going to be a short class. So what is FDEIA? Food dependent exercise induced anaphylaxis. So what is it? It is basically anaphylaxis following food consumption. Also added to that, there is an exercise component. That's all. As simple as that. So diagnostic criteria, if you see in page 82, they have given clinical diagnosis of anaphylaxis according to WAO. What is WAO? I think World Allergy Organization, something. Yes, World Allergy Organization. Okay. So World Allergy Organization for anaphylaxis. So what they have given is anaphylaxis basically 2 criteria. Okay, so if either one of these are satisfied, you can call them as anaphylaxis. So one is acute onset, child is coming with laryngospasm, bronchospasm, or a circulatory collapse. So if either three are there, you can call them as anaphylaxis despite absence of skin or mucosal involvement. This is criteria 1. Criteria 2 is they have an acute onset illness with simultaneous involvement of skin and mucosa. Skin can be urticaria hives, your mucosa can be your periorbital puffiness, your lips edema, tongue edema, and all that. Along with that, at least one of either respiratory compromise or reduced BP or severe GI symptoms. So if these are there, if this criteria is satisfied also, you can call them as anaphylaxis. So anaphylaxis criteria should be there to call them as food dependent exercise induced anaphylaxis. So anaphylaxis part we covered. What about this food dependent part? So after within 4 hours of ingestion of the suspected food which you think could be the allergen. So food dependent, that is done. Exercise induced. The patient should also have a definite history of exertion after consumption of this food. Suppose this patient has not physically exerted, then it is not food dependent exercise induced anaphylaxis. Okay, so food consumption should be there, exercise history should be there, anaphylaxis should be there. All these put together will become your food dependent exercise induced anaphylaxis. Suppose if the patient is not doing an exercise but still having anaphylaxis, it's not exercise induced, food dependent. Okay, and if you are able to demonstrate your IgE to the specific food protein, then well and good. You have documented that this is the food allergen that is inducing this FDEIA. Let's say FDEIA. It's very difficult to say this food dependent exercise induced anaphylaxis each time. So this is about your definition or an intro. It was very much underdiagnosed. Now it is slowly being recognized more and more, because most of the cases used to be labeled as idiopathic anaphylaxis or food induced anaphylaxis. Why it is important is you can basically avoid taking the food prior to doing exercise, 4 hours prior to doing exercise or 1 hour after doing a strenuous exercise. So that will basically make sure the child does not have an anaphylaxis. That's why this entity is important. Okay, so it is very rare. Okay, maybe because it was under recognized, we do not know. Japan, they have reported about 0.017%. That's all. So there are few types of exercise induced anaphylaxis. One is non-food dependent, the other one is food dependent or food specific. So non-food dependent is does not matter what food you take. You exercise after 4 hours, you have an anaphylaxis. So that is non-food dependent. Food dependent is only for specific food. After consumption, after exercise, the child develops an anaphylaxis. So why this happens? They have given multiple pathophysiological mechanisms. So when you exercise, your blood circulation increases to gut. So what they say is the gut permeability increases during exercise. That is one. So the food allergen protein can increase easily. And this protein which is coming will be circulated to rest of your body, your skin, muscle, etc. So where they get sensitized, where your body recognizes that this is a foreign protein and mounts a allergic anaphylactic response. Plus during exercise, your pH basically changes, your osmolarity basically changes. So what does it do? Your pH change will cause mast cell degradation. Your osmolarity change, again, it is going to cause what? Histamine release. Okay, and exercise per se will activate your WBCs to release all pro-inflammatory cytokines. So all of these put together causes increased risk of food FDEIA. Okay. So this is how it happens. So does this happen all the time? If the patient is predisposed, yes, it happens. If there are few triggers can be anything, any stress, any cold environment, any hot environment, any alcohol consumption, any NSAID consumption, any co-infection that the child is having, sleep deprivation rarely. So all of these stress factors, if it is together along with a tendency for FDEIA, yes, the child can go on to have FDEIA. So how will they present? Just like any other anaphylaxis, they are going to present. Initially, they can have skin manifestations, urticaria, itchiness, redness, and all that, swelling, puffiness, lips swelling, your tongue swelling can happen. Then they can go on to have hypotension, respiratory compromise, GI manifestations, etc. So if this patient is going to come, how are you going to diagnose? Diagnosis is basically by history. Investigations is not going to help you diagnose that this is FDEIA, but it will help you to find out what has triggered this, what food has triggered this anaphylaxis along with exercise. So in India, it is generally wheat. Okay. And I was surprised to see chickpea and orange also in the list. That is very weird, no? But having said that, wheat is the most common. So whenever you are doing a skin prick test for wheat, what they have suggested is they are generally sensitive to the omega-5 gliadin component of wheat. 80% of them. 20% of them are sensitive to high molecular weight glutenin. So if you are going to test them with your whole wheat preparation, what happens is this omega-5 gliadin content is very less. So you may miss detecting these people. So ideally you will have to do extract, not the whole wheat commercial extract. You will have to specifically look for this omega-5 gliadin component sensitivity to the patient. So you will have to extract that specifically and get it done. Okay, so that is one. Second one, you can get a serum tryptase level done. Serum tryptase, when measured within 6 hours, it's got good, it is good enough to say that the patient has had an anaphylactic reaction. They usually normalize by 48 hours. So if at all you're going to do, you have to do it within 6 hours. So that is when it is most helpful. So the skin prick test will tell you what food the child is allergic to. Next, you will have to identify whether this child is having an exercise-induced reaction to the food that is consumed. So how are you going to do that? You can do a challenge test. So what is challenge test? What they do is there's a modified protocol by Thailand. So they give aspirin initially. So why do they give aspirin initially? To make sure it is not a drug-induced reaction. Then they make the child exercise. Why exercise? Because exercise-induced anaphylaxis is a separate entity all in itself. So now the child does not have anaphylaxis. Then they give the food protein alone, whatever food you are suspecting the child is having allergy to. So this is to make sure without exercise, the child is not having anaphylaxis to the food. Then they give everything together. They give aspirin as a stressor. They give food. Then they make the child exercise to see if the child is developing a FDEIA. Okay, so how long do they want the child to exercise? At least for 6 minutes till the heart rate is 80% of the maximal heart rate that is expected for that age and sex. So if the child develops an anaphylaxis, then you know, yes, this challenge test is positive. This child is allergic to this food. Following the consumption of the food and following exercise, this child develops a FDEIA. So how are you going to manage? The best way to manage is prevention. Okay, there are reports of sodium chromoglycate that is being used, or food sensitization that is being done, or desensitization rather, not desensitization that is being done. But these are all only case reports. They do not show consistent results. And desensitization, especially if the child is having a vigorous exercise, then that will still be good enough to cause a anaphylaxis. So prevention is best. How do you prevent? You avoid that precipitating food prior to exercise for 4 hours and after exercise for at least 1 hour. Suppose the child is coming with anaphylaxis, then you treat like any other anaphylaxis. It is not going to be any difference. I think treatment of anaphylaxis, we have already discussed 0.01 mg per kg of adrenaline. You will give intramuscular, very, very important, intramuscular in anterolateral thigh as early as possible. So that is going to take care of it, along with supportive care of management, whether it's respiratory compromise or laryngospasm or your cardiovascular compromise. So you basically have to educate the patient and the parent about the possibility of this happening again if the child consumes the specific food followed by exercise. And always carry, we don't have EpiPens. If we can carry EpiPens, that will be nice. But at least they have to know enough to identify what can trigger. And if at all it is triggering, they should be able to identify the early symptoms, and they should be able to reach the nearest hospital enough to say that this is what has happened, boss, this is what treatment is needed. So that's about your FDEIA. Hope this helps. Suppose this question comes, Naga, then you should be able to write at least few sentences. That is the reason I took this class. So hope this was useful. Bye bye. Thank you and all the best.